My name is Mary Molewyk Doornbos, and I'm a professor of nursing emerita and a senior research fellow at Calvin University in Grand Rapids, Michigan.
My name is Gail Landheer, Zandee. I'm an associate professor of nursing and the community partnership coordinator, also at the Calvin University nursing program. During a curriculum revision 25 years ago, our nursing department really wrestled with how best to teach and promote student learning in our community nursing practicums. We asked ourselves some hard questions, such as what if our practicum experiences could be designed to not only teach about health disparities, but to actually address them? What if faculty research was collaboratively conducted with local under-resourced neighborhoods to improve the health of the community? In response to those questions, we explored a practicum instruction model where community-based participatory research, or CBPR, was used to listen to our local community and address health disparities. So CBPR is this collaborative approach to inquiry where residents of the community are involved in each step of the research process, identifying their most pressing health concerns and the solutions. So residents of 3 local under-resourced neighborhoods identified mental health, particularly depression and anxiety, as one of the most pressing health concerns, and the desire to be trained as a lay ambassador for mental health as the solution. So in part, community members were inspiration for this research as they identified the Mental Health Ambassador Program as a recommended solution to address depression and anxiety.
As we listened to that voice of the community, it was so apparent that we could collaborate together using their expertise and ours to develop this solution, which was then called a Mental Health Ambassador Program. The results highlighted 3,800 touches. We call touches, we define those as mental health conversations. So over 3,800 touches with over 1,600 individuals of differing genders, race, ethnicity, ages, and so on. So we were just really struck by what those ambassadors were able to do in terms of their reach within the communities. When we looked at the mental health ambassadors themselves, we were excited about these results as well. They were highly satisfied with the program, and from pre-training to 4 to 9 months later, we noted that their mental health literacy scores increased by 5 points and that their mental health stigma scores decreased. When we look at the way forward and how those might be applied to practice, we begin thinking about the fact that nurses and mental health nurses in particular may be able to think very broadly about their practice. They may be able to focus on identifying and documenting the needs of whole communities and then implementing upstream preventative sort of care using lay residents of those communities. Their role may shift to documenting community need, recruiting some of those ambassadors, residents who might be eager to do this, overseeing their training, mentoring them, supervising their care, and so on. So with these results, we can maybe begin to think just a little bit about how the mental health nursing role could be reshaped in collaboration with communities and with those lay mental health ambassadors.
So once the Mental Health Ambassador Program was implemented, researched, and found to be evidence-based, our next step was to move that Mental Health Ambassador Program out of academia and into practice.
First of all, we were very concerned about access to the training, given that we wanted to sustain this community-driven solution. So since that time, we have obtained further grant funding such that the training is online. So we are able to offer it broadly to individuals, and that was one strategy that we used to move towards sustainability. We also were hoping that this could be used beyond what we had begun. And so to that end, we had some municipal funding, and we actually have a municipal grant in process now where 40 mental health ambassadors are doing work in that particular municipality. So the city is actually funding us, and there are 40 individuals out doing mental health ambassador kind of work in their communities. And then from there, we began thinking about whether there could be potential impacts on the healthcare delivery system. So we've had some interest from a healthcare system relative to perhaps training their frontline staff using the Mental Health Ambassador Program. So in these ways, we're attempting to honor the collaborative solution that was formed, and we're trying to ensure that it's sustained, that it comes out of academia and it can be used in the community and potentially in the healthcare delivery system as something that residents themselves suggested, created, and collaborated on.